All right, I need you to hear me on this one, because what I am about to walk you through is one of those things that genuinely makes me frustrated on behalf of Florida seniors. There is real money. We are talking about the kind of money that changes whether somebody eats through the end of the month, whether somebody keeps the air conditioning running in August, whether somebody can afford the prescription their doctor just changed them to. And most of the people who qualify for it never claim it. Not because they are lazy, not because they are uninformed, because the system is genuinely designed in a way that hides this from you, and very few people are willing to sit down and read every line of every rule and translate it into plain English. So that is exactly what I did. I read all of it. I went through the Medicare Savings Program rules for Florida, the low-income subsidy guidelines for Part D, the supplemental benefit catalogs for Medicare Advantage plans in Florida, the Shine Counseling eligibility, the Area Agency on Aging programs, the dual eligible special needs plan structure, and I put it all in one place. Today we are doing this the honest way, the good, the bad, and the ugly. And I'm going to show you the math on a real monthly basis so you can see exactly what you might be owed and exactly how to go get it. Let me show you how we got here. Florida has more seniors than almost any state in the country. I do not need to throw a stat at you. You have seen the crosswalks. You have seen the Publix lines at 9 a.m. The fact is, Florida is one of the top 2 or 3 states for population age 65 and older, and that creates a perfect storm for missed benefits. Here's the thing. Medicare itself was never designed to be the whole story. Original Medicare, Part A and Part B, covers a lot, but it does not cover dental, it does not cover vision, it does not cover hearing, it does not cover most long-term care, it does not cover your prescriptions completely. Medicare was always meant to be paired with other programs, and those other programs live in a maze of agencies, application portals, income thresholds, asset tests, and paperwork that would frustrate a lawyer. So when somebody turns 65, they get a stack of mail, they talk to maybe one person at Social Security, they pick a Medicare Advantage plan from a broker who is incentivized to push a particular plan, and they think they are done. They are not done. They are sitting on top of programs that pay real money, and most of them never even heard of the programs. Now let me show you what I mean by real money, and I want to be honest with you about the $390 figure you may have seen attached to this topic because I do not want to mislead anybody. There is no single check that arrives in your mailbox for exactly $390 every month from one program called the Senior Benefit. What there is a stack of programs that, when fully claimed, when properly layered, when combined with the supplemental benefits inside a Medicare Advantage plan and the state programs that sit on top of Medicare, regularly produce a combined monthly value in that range for a Florida senior who qualifies on income. Let me be clear about that. This is the realistic combined value across multiple programs working together, not a single check. And honestly, because different seniors have different incomes, different counties, different plan choices, and different health situations, the number swings. Some seniors will get less, some seniors will get more. But the headline figure is roughly accurate for a typical Florida senior who qualifies and actually stacks the benefits. Let me walk you through the 5 programs that add up to that number. The first program is the Medicare Savings Program. In Florida, this is administered through the Department of Children and Families, the same agency that handles food stamps and Medicaid, and there are 3 tiers. There is QMB, the Qualified Medicare Beneficiary Program. There is SLMB, the Specified Low-Income Medicare Beneficiary Program. And there is QI, the Qualifying Individual Program. Each tier has a different income threshold, and each tier pays for something slightly different. QMB pays your Medicare Part B premium every month, and for most Florida seniors in 2025, that is around $185 a month savings right there. It also covers your Part A premium if you owe one, your deductibles, and your coinsurance. SLMB and QI pay just the Part B premium, so depending on which tier you qualify for, you are looking at roughly $185 a month just from the Medicare Savings Program, and most Florida seniors who qualify do not know it exists. They just keep paying the Part B premium out of their Social Security check every month, never realizing the state would have picked it up if they had applied. The second program is the Low-Income Subsidy for Part D, also called Extra Help. This is a federal program run through Social Security. If your income and assets are below certain thresholds, the federal government pays part or all of your Part D prescription drug plan premium. It lowers your deductible and it caps your copays on prescriptions. The exact cap is something like $4.50 for a generic and $11.20 for a brand name if you are on the full subsidy tier. For a senior taking 5 or 6 regular prescriptions, that alone can be worth hundreds of dollars a month compared to what they were paying without the subsidy. And this is a separate application from the Medicare Savings Program. You can qualify for one and not the other, or qualify for both. The third program is the Medicare Advantage Supplemental Benefits. Now hold that, because this is where it gets sneaky. Medicare Advantage plans in Florida are marketing hard right now, and the ads you see on television love to talk about extra benefits. They talk about dental allowances, vision allowances, hearing aid coverage, over-the-counter allowance cards, transportation to doctor appointments, fitness memberships, and even food benefits for qualifying chronic conditions. The problem is that the brokers who sell these plans, and I have been clear about this before, are incentivized to push the plan that pays them the highest commission. They are not necessarily pushing the plan that has the richest supplemental benefit bundle for your specific situation. So a senior might be enrolled in a plan that offers a $50 quarterly over-the-counter allowance when the next plan over offers $200 quarterly over-the-counter plus transportation plus a food card for chronic conditions. Same network, different value. Switching during the right enrollment window can put another $50 to $150 a month in value back in that senior's pocket. The fourth program is the Florida-specific Medicaid programs for seniors who are dual eligible. A dual eligible is somebody who qualifies for both Medicare and Medicaid. In Florida, that opens up case management, additional transportation, behavioral health services, and the dual eligible special needs plan structure that bundles Medicare and Medicaid benefits into one plan. If you are dual eligible and you are not on a DSNP, you are almost certainly leaving coordination money on the table. SHINE, which is Florida's free Medicare counseling program, will help you figure that out for free. The fifth program is the Area Agency on Aging Benefits. Florida has a network of area agencies on aging that operate in every region of the state. They run programs like the Older Americans Act Nutrition Program, in-home support, caregiver respite, assisted transportation, the Long-Term Care Ombudsman Program, and SHIP-type grants. Most of these are not advertised because they are block-funded. They are filled on a first-come, first-served basis, and they quietly close enrollment when the funding runs out. So the senior who calls in March might get help. The senior who calls in November might not. That is the ugly part of this, and we are going to come back to it. So when I add the typical real monthly value of a Medicare savings program tier like QMB at roughly $185 saved on Part B premium, plus a low-income subsidy reducing drug costs by another $50 to $150 a month for somebody on multiple prescriptions, plus a Medicare Advantage supplemental bundle of $50 to $200 a month across OTC, transportation, dental offsets, and food cards, plus potential dual eligible coordination, plus the value of one or two area agency on aging services like meal delivery, you start to see how a Florida senior who is fully stacked on every program can easily land in that $390 per month range. Some will be higher, some will be lower, but the headline is honest, and the techniques to capture it are absolutely real. Now here is the bad news, and I want to sit with this one for a minute because it is the part of the story that makes me the most frustrated. The bad news is that nobody proactively tells you about most of this. Medicare does not send you a checklist. Social Security does not call. Your doctor's office does not run a benefit screening. The DCF office in your county does not reach out. The brokers selling Medicare Advantage plans are legally prohibited from doing a comprehensive benefits analysis for you unless they are also licensed in a way that allows it, and most of them are not. So the senior has to know to ask, and the senior has to know what to ask for, and the senior has to know where to apply, and that is where the missing $390 lives. It sits in the gap between what the senior was told and what the senior does not know to ask about. Let me give you the one box you should never leave empty. The box is on the application. Just about every benefits application in Florida, whether it is the DCF application for the Medicare Savings Program, or the Social Security application for extra help, or the Medicare Advantage enrollment form itself, has a section near the end that asks whether you want to apply for additional programs or whether you want a benefits screening. Most applicants leave that box blank. They do not know what it means. They think they are just signing up for the thing they were originally applying for, and they leave the door closed on every related program. Now here is the thing, when you check that box, your application goes to a benefits screener, and that screener is trained to evaluate you for every program your income and assets might qualify for. They are not going to call you to ask permission. They are going to run the math and add you to the programs you qualify for. If you skip that box, you are handing them permission to ignore everything else, and that is the silent kill switch on the $390 a month most Florida seniors never see. I cannot stress this enough. Check the box. If you have already applied without checking it, you can usually fix it. SHINE will help you. Phone a friend, call SHINE. Now let me give you the math for 3 Florida households because I want this to feel real to you and I want you to picture yourself or somebody you love in one of these scenarios. Scenario number 1 is a single senior living in Pasco County. Her name in this scenario is Linda. Linda is 68. She is on a fixed Social Security income of about $1,750 a month. She has roughly $9,000 in the bank. She pays rent. She is on 3 regular prescriptions. If Linda applies for the low-income subsidy, She will almost certainly qualify at the full subsidy tier because her income is below the federal poverty line for a single individual. That means her Part D premium drops to zero, her deductible drops to zero, and her prescription copays are capped at the lower amounts I mentioned. If Linda applies for the Medicare Savings Program, she likely qualifies for QMB or SLMB, depending on the exact threshold for the year. That pays her Part B premium of around $185 a month. If Linda enrolls in the right Medicare Advantage plan during her enrollment window, she can pick up a supplemental benefit bundle worth another $80 to $150 a month in OTC, transportation, dental offsets, and potentially food benefits if she has one of the qualifying chronic conditions. When you add it up, Linda is leaving somewhere between $250 and $400 a month on the table if she does nothing. That is rent. That is groceries. That is medication. Linda's cousin might have told her Medicare was just insurance. Linda skips the box. Linda loses the money. That is the story I see over and over. Scenario number 2 is a retired couple in Volusia County. Their names are Bob and Carol. They are 71 and 69. Their combined Social Security is $4,300 a month. They own their home free and clear, so they do not have a rent burden, but they do have property taxes, insurance, and the full cost of 2 Medicare Part B premiums, 2 Part D plans, and their supplemental Medicare coverage. Bob and Carol are over the income threshold for the full Medicare Savings Program. They are not going to qualify for QMB or SLMB because their combined income pushes them out. But here is what they might be missing. They might qualify for one of the dual eligible programs if one of them has a specific health condition. They might qualify for chronic condition food benefits on a Medicare Advantage plan if one of them is diabetic or has cardiac issues. And they might be eligible for the Energy Assistance Program through their county for help on their FPL electric bill. The point is, even at $4,300 a month, Bob and Carol have missed benefit opportunities. The number is smaller, maybe $80 to $150 a month in combined value, but it is real. And they are paying property taxes in Florida on a homesteaded home, which means every dollar of missed benefits is a dollar they are earning out of their pocket instead of getting from the program. That compounds over a year. That is $1,000 to $1,800 a year of real money for a couple who thinks they make too much to qualify. They might be wrong. Scenario number 3 is a dual eligible senior in Miami-Dade County. His name is Roberto. He is 74. His income is $1,200 a month. He has cognitive decline that requires caregiver support. Roberto qualifies for Medicaid and Medicare. He qualifies for the full Medicare Savings Program. He qualifies for the full low-income subsidy. He qualifies for a dual eligible special needs plan with a rich supplemental benefit bundle. And he likely qualifies for the Program of All-Inclusive Care for the Elderly, also called PACE, which provides adult day health services, transportation, meals, and case management in many Florida counties. Roberto is leaving potentially $600 to $800 a month on the table if he is not fully stacked. Roberto's family could be paying out of pocket for caregiving that the program would cover. Roberto's family could be paying for medication copays that the program would waive. Roberto's family does not know because nobody ever walked them through it. Now let me give you the ugly truth. The ugly truth is that the system relies on you asking. The system relies on you checking the box. The system relies on you calling SHINE, the free Florida Medicare counseling program run through the Department of Elder Affairs. The system does not proactively identify you and offer you the money, and there is a reason for that. And I am going to give it to you straight. The reason is funding. The Medicare Savings Program is funded through a combination of state and federal dollars, and the federal government pays a higher share when states expand enrollment. But the state still has a cost. The state has a budget. The state has a legislature. And there are legislators in Tallahassee who do not want every eligible senior to enroll because enrollment costs money. So the application process is hard. The recertification process is hard. The income documentation is heavy. Some of the income limits have not been updated in years. And there are seniors who are barely over the threshold because of a $50 a month Social Security cost of living adjustment, and they cannot get back in. That is the ugly truth. The system is not built to catch you. The system is built in a way that requires you to be your own advocate. And most seniors, especially those who just moved to Florida and are figuring out the new state, do not even know what they are supposed to advocate for. So unless somebody like SHINE or Area Agency on Aging or a Benefits Enrollment Center catches them, the senior pays out of pocket. Now let me hit the hidden fine print because there are 5 things in this that fit on no yard sign and almost never get explained. Fine print item number 1. The Medicare Savings Program recertification cycle in Florida is annual. That means every year you have to renew. You have to prove your income. You have to prove your assets. And if you do not, you lose the benefit. The state has been sending paper renewal forms to addresses that may have changed, especially for seniors who recently moved to Florida, and the renewal goes to the wrong mailbox and the senior loses their $185 a month Part B premium payment without ever knowing it happened. I would bet a significant percentage of the readers and viewers of this channel right now have a parent who lost their Medicare savings program because they did not return a recertification form that they never received. If that is you, this is fixable. Call Shine, redetermine. Fine print item number 2. The income limit for QMB in Florida in 2025 is around $1,325 a month for a single individual and around $1,783 for a couple, with some asset limits. But those limits have not always been enforced, and there is policy chatter about tightening them. If you are right at the threshold, the question is whether you have an asset that pushes you over and whether the analysis counts the asset the way you think it does. The asset test does not count your primary residence, it does not count one vehicle, it does not count personal property, but it does count bank accounts above a certain floor, and it does count brokerage accounts. If a senior recently sold a Florida home that was not their Florida primary residence, they might be over the asset limit temporarily. Timing of the application matters. This is why benefits screening matters. Apply at the wrong time and you get denied and you stay denied. Apply at the right time and you get approved. Fine print item number 3. The Social Security cost of living adjustment, often called the COLA, can push you over the income threshold, and that is why it matters when you apply. Last year's COLA was 2.5%. This year's COLA was also in that range. That is roughly $45 to $60 more a month for a senior making around $2,000. If your income was $1,300 last year and the COLA pushes you to $1,345, you might have just fallen out of QMB. That single Social Security decision just cost you $185 a month in Part B premium coverage. So the application timing relative to the COLA and relative to your retirement account withdrawals matters a lot. This is where Shine, which is free, earns its value. Fine print item number 4. Medicare Advantage plan selection is the highest leverage decision most Florida seniors make every year, and it is the one where the marketing is loudest. The supplemental benefit catalogs are not standardized. One plan might list a $50 quarterly OTC card, and another plan in the same county with the same network might list $200 quarterly, plus transportation, plus a food card. PPO plans typically have broader networks. HMO plans typically have richer supplemental bundles, but narrower networks. SNP plans, especially DSNPs, are typically rich in supplemental benefits because the members are higher cost and the plans compete on those benefits. If you do not review your plan every year during the annual election period from October 15th to December 7th, you are not optimizing. You are probably overpaying. I am not telling you what to do. I am telling you there is something to do. This is my prediction, not a guarantee. The senior who reviews every year picks up an extra $80 to $200 a month on average. This is my prediction. Flag it. Fine print item number 5, and this is the one that really frustrates me. The Medicaid programs for seniors, including the long-term care Medicaid waiver programs like the statewide Medicaid Managed Care Long-Term Care Program, are not the same as the Medicaid programs for families with children. They have different eligibility rules, they have different asset rules, they have look-back periods on transfers, they have income trusts that can be set up for excess income, and there is a 5-year look-back on asset transfers if you apply for long-term care Medicaid. If a Florida senior bought a grandchild a car 2 years ago or added a child to the house deed 2 years ago, they may have just blown up their eligibility for long-term care Medicaid. They have to be 5 years clean. This is where Florida-specific elder law counsel earns real money, and where a missed conversation with an elder law attorney costs a family hundreds of thousands of dollars in long-term care costs down the road. I am not your attorney. I am not telling you what to do, but I am telling you the conversation needs to happen now, not after the medical event. All right, let me give you the verdict. Here is the honest assessment. Is $390 a month per senior realistic? Yes, for a fully stacked Florida senior who qualifies on income. Is it guaranteed for every senior? No. Is it possible to get close to it for many Florida seniors? Yes, especially with Shine and the Area Agency on Aging helping. Is the system designed to make it easy? No. Is the system designed to make it hard? Honestly, yes, sometimes. Is it worth pursuing? For a senior on a fixed income, absolutely yes, because we are talking about rent, food, medication, electric bill. This is not steak versus chips. This is whether somebody eats through the end of the month. Here is your decision framework. If you are 65 or older, here's what you do. Step 1, call Shine. The number is 1-800-96-ELDER, free. They will walk you through a benefits screening. Step 2, apply for the Medicare Savings Program through DCF Access if Shine tells you to. Check the box for additional screenings. Step 3, apply for extra help through Social Security. The form is on ssa.gov. Step 4. Review your Medicare Advantage plan or your original Medicare plus Medigap coverage every annual election period. Do not let a broker shop you into the wrong plan for their commission. Step 5. If you have assets, talk to a Florida licensed elder law attorney. Not because I am telling you what to do, but because the look-back rules are real. Now here is what I need from you. Subscribe so you are always informed. Drop a comment with your zip code and your situation. Single, couple, dual eligible, whatever. I read them all. Send this to one Florida senior who has told you they think Medicare is just insurance. They need to see this today. Download the free Sunshine State Handbook linked in the description. It has the SHINE number, the DCF application link, the area agency on aging contacts by region, and a checklist of the 5 programs we covered today. It is free. Share it with a neighbor. Helps me, helps them, helps you. We will see you in the next one.